Today we will discuss how to document fluids administered in the PACU specific setting after receiving care by anesthesia and before transferring to the floor or ICU. We will use two different patient situations to help explain the process. In the first situation, a patient presents to the PACU and there's an active order on the chart for lactated ringers or normal saline or any other fluid. When the RN opens their flowsheet dock, they navigate to the intake and output band, and they will see a row for the fluids listed under continuous infusions. To document the intake related to that fluid continued from the OR, the nurse needs to be specific in the process and not double document the intake, and also not double charge the patient for the bag of fluid. In order to do this, the intake documentation intraoperatively is determined to be the responsibility of the CRNA or anesthesiologist and should not be redocumented by the nurse. This will cause inaccuracies with the intake and output totals and give an inaccurate statement of the patient's fluid volume status. If the nurse has documented a continuous infusion that will continue after PACU, it should be treated differently than if they are going to discontinue a bag before PACU discharge. To document a bag of fluid DC'd before PACU discharge, we will use the order for the lactated ringers. Find the lactated ringers line item, right-click and choose Chart Details. You can bypass this pharmacy verification because this fluid is already running, and you will find this lactated ringers administration window open. When the total volume of the bag infused throughout the whole PACU stay is going to be documented, the next step is to choose Infuse or Bolus. If you choose Infuse, there's a Bolus option which automatically switches to Bolus. In this scenario, we will document the entire amount of fluids that were given for the entire PACU stay, making sure to document the time the patient arrived in the From window. In this situation, they arrived in the PACU at 9 o'clock, and the time they left in the To window. Then we will document the required yellow fields. This is bag number 1, and the site was in their right arm. Choose Apply, and then sign the window, and you will find your total fluids are documented. Because this patient will not have any more of this fluid going, if it's not part of the anesthesia power plan, as is seen in this one, the order needs to be discontinued individually by the nurse through the orders profile window. If it's part of the anesthesia power plan, it will be discontinued when the nurse discontinues the entire anesthesia power plans. To document a new drug that was started in the OR but is expected to continue on the floor, the drug should be ordered in the system and is likely to be in the surgeon's floor power plan or as an individual order. In this scenario, we will use sodium chloride 0.45%, 1,000 milliliter bag. If the order does not exist, you must clarify with the surgeon and place the order to continue the drug infusion. Because this drug was started by anesthesia and you are continuing the drug but not beginning a new bag, we will use flowsheet to continue the documentation. Locate the line item in the intake and output band, right-click and choose Chart Details, skip the verification because the bag is already infusing, and on this time we will choose Rate Change. Be sure to change the time to when the patient arrived in the PACU, 0900, document the bag as 1, and the ordered infusion rate of 75 milliliters per hour. Click Apply, and then sign your documentation with the green check mark. You have now documented the continued infusion of the drug, but not the intake amount. It's important to note that you cannot future chart intake using the flowsheet doc. The best practice is to wait until the patient is ready to transfer to the floor before documenting the intake. To document the intake, double-click each hour that the patient was in the PACU into the flowsheet cells. Bypass each verification window. The numbers will pull in purple. These numbers need to be signed off with the green check mark before leaving the flowsheet dock. Sign all these numbers off with the green check mark.